Hello and welcome everyone. My name is Ghassan Abu-Sittah. I'm the Executive Director of the Institute for Palestine Studies, USA, based here in Washington, D.C. On behalf of IPS USA and our colleagues at the Institute for Palestine Studies in Beirut and Ramallah, I'm honored to welcome you all to this important event, the launch of our new platform documenting the targeting and destruction of the health sector in the Gaza Strip. This platform offers detailed documentation of Israeli assaults on healthcare facilities and personnel in Gaza. It shows the systematic targeting of medical workers as part of Israel's broader strategy to make Gaza uninhabitable. It features expert analyses, testimonies, and statements from international organizations, and will serve as an essential resource for researchers and historians. This project is ongoing, starting with secondary sources and expanding through field research. As Israel's brutal genocide in the Gaza Strip continues to unfold and expand to other parts of Palestine, IPS remains committed to producing high-quality knowledge, documentation, and analysis on the various aspects of Israel's assault on Palestinian life and dignity. Our team members and colleagues in Palestine and beyond are working day and night to ensure this moment is captured and documented with proper, detailed, fact-based analysis and documentation. In the near future, IPS plans to launch additional databases documenting the destruction of other sectors in Gaza, including education, culture, historical heritage, and more. For further details on our work and to explore our wide range of digital and print publications, including books, journals, in-depth analyses, and blogs, available in both Arabic and English, please visit our website at palestine-studies.org. Here's what you can expect from today's event. First, we will hear from our esteemed speakers, who I will introduce shortly. Then I will ask a few follow-up questions. And finally, we will open the floor for a Q&A session. For those of you on Zoom, please submit your questions using the Q&A feature. If you are tuning in through our social media channels, feel free to drop your questions in the comments, and we will make sure to address them as well. So now, allow me to introduce our distinguished speakers, whose full bios are available on the event page, but here is a brief introduction. First, I would like to welcome Dr. Ghassan Abu-Sittah, who is a Palestinian British physician and associate professor of surgery, known for his work as a plastic and reconstructive surgeon in conflict zones such as Yemen, Iraq, Syria, southern Lebanon, and Gaza. He received his medical education at the University of Glasgow, completed his residency in London, and went on to become head of the plastic surgery department at the American University of Beirut in 2012. He's also the founding director of the conflict medicine program at the Global Health Institute and at AUB. Dr. Ghassan heroically served during the first months of this genocide in Gaza City, where he worked there during the heaviest months of bombardment months ago. Also, allow me to welcome Dr. Layth Hanbali, who is a community health researcher and the coordinator of IPS's database on the destruction of Gaza's health sector. He is embarking on a PhD in history at the Free University of Brussels and Birzeit University, where he will focus on anti-colonial resistance through health. Now, I'm pleased to invite Dr. Ghassan Abu-Sittah to kick things off by discussing the significance of this database, both for Palestinians and beyond, along with some historical background and future implications for this database. Dr. Ghassan, welcome. The floor is yours.
Thank you, Jihad, and thank you everyone for I don't know how, not coming, but tuning in or logging in. So just over a week ago, and in the midst of all the debate regarding polio vaccines and the spread of polio, which had been eradicated in Gaza since the late 70s, Israel assassinated the head of the Central Microbiology Lab at the Ministry of Health. That targeted killing highlights the fact that Israel has made the destruction of the health system central to the strategy of this war. And this destruction is not limited to one aspect of the health system, but has been a systematic dismantling of all aspects of the health system. Destruction of almost 33 of the 36 hospitals, killing over 500 doctors, nurses, and health and paramedics, imprisoning over 170 others, killing some of them under torture in the process, and creating a destroyed and uninhabitable public health infrastructure that then propagates disease and ill health. The centrality of the health system to this war and the destruction of the health system to this war merits that we try to understand and to archive in as much detail as possible and from every possible angle the story of the Palestinian health system in this genocidal war. We want to understand how we came to find that Shifa Hospital, Gaza's largest space of healing, Gaza's largest hospital, was turned into a mass grave, and so was the second largest hospital, Nasser Hospital, and why. We need to understand how Israel made sure that within under 8 months of the war, over 2 million Palestinians had no meaningful access to health. And this is critical for us to first understand this particular genocide, but also to understand the health system in Palestine, and particularly during this war, as a site of Palestinian resistance. In addition to being a site of elimination and erasure, the health system in Gaza has been a site of awe-inspiring resistance, individual stories, individual health workers who have stood their ground and insisted on providing healthcare to their people in the most difficult of all circumstances. As we watch the administration building in Shifa Hospital being repaired and turned into an emergency room, or the Indonesian hospital at the edges of Jabalia camp being refurbished for the third time after Israeli attacks, or the remnants of Ahli Hospital being turned into Gaza City's only makeshift hospital. We need to try to understand how Palestinians view healthcare and the provision of healthcare as an integral part of their national liberation struggle, as the antithesis of the necropolitics of genocide, the giving of life as the antithesis of the taking of life. But we need to do all of that not just so that the Palestinians have an archive and a record of this critical juncture in our history. We need to do that because we know that today's war in Gaza will be replicated elsewhere. Global capital's existential problem with surplus populations is being tested out in the Gaza Strip through the erasure of Palestinians, particularly in Gaza, who constitute a political form of surplus population. As we document and record this genocide and the centrality of the health system in this genocide, military academies are also studying the attacks and the destruction of the health system, because it will become a central part of the conduct of any war. Scorched earth policies of the 70s will now include the systematic destruction of the health system in order to ensure uninhabitable land. And so for the future of humanity, we need to understand this first example of the destruction of the health system as not just a critical component of genocide, but of the conduct of wars to come. Through archiving, analyzing, and recording of testimonies of different individuals who played differing roles and who were witnesses to that story, the story of that dismantling and destruction of the health system, and the story of the resistance of the Palestinian health workers to this death world of genocide. We hope that we create the kind of archive that will be of use for generations to come. We have a long way to go, not just because the genocide, to the humanity's shame, is continuing almost a year on, but we need to move from recording to interviewing and creating a database of interviews and primary data that will be an archive and a documentation of the primary sources of people's stories, of doctors, of nurses, of witnesses of victims that tell the story of this health system. We hope to move forward and continue this archiving process, and with everybody's help, we will hopefully give at least some record of this greatest site of inhumanity and this greatest site of humanity, of resistance. Thank you again for coming, and we hope that this is the beginning of a rich and florid archive. Thank you.
Thank you so much, Dr. Ghassan, for your powerful remarks. Next, we will hear from Dr. Layth Hanbali, who will talk about the mechanics behind this project, how the database was designed, how information was collected, and what we hope to accomplish moving forward. He will also give us a small tour of the database itself. Dr. Layth, the floor is yours.
Thank you so much, Jihad. Thank you, of course, Ghassan. And I want to just kind of recognize Ghassan here as a truly kind of inspirational guide and supervisor and mentor who helped kind of pave the way for a lot of the thinking behind the importance of the database and tracking its progress through, and then also, I think, inspiring all of us, not just in these projects, but you know, in the rest of our lives as well. I will just open before going into the mechanics, I guess, just with some things that may be a re-emphasizing of some things that Ghassan said, and then some things that that kind of framed the way that we've thought about the project since its beginning. And really, it's important here just to note that the work that we've been doing to document the targeting and destruction of the health sector in Gaza, we've done with by understanding it as part of a broader Israeli strategy of entirely dismantling the lifelines that sustain the Palestinian people, especially in Gaza. And this obviously has culminated in the genocidal war that is unfolding today, but is the culmination of prolonged processes over decades through which Gaza has been suffocated through occupation and siege. And so while obviously there are exceptions that we see with the way that the genocide has been conducted, it's important to think of the genocidal war not as an isolated, aberrant event or an exception, but as a calculated continuation of Zionist settler colonialism. And at the end of the day, settler colonialism aims to erase Palestinians. It aims to dispossess Palestinians. That's through, in the genocide, making or trying to make the Gaza Strip unlivable. And that's the framework through which we've understood the dismantling of the health sector. And this is also why, as Ghassan emphasized, it's important to think of and reaffirm the importance of the resistance that's inherent in any practice that reaffirms life and that resists the death world that Israel tries to impose. And that includes the Gazan health systems, both leading up to and during the genocide. And so as we see this unprecedented attack on health, the most essential service to sustain life, it's also then important to think of health within a broad concept of what we call a war biosphere. And this is something that Ghassan has written and spoken about extensively, where the Israeli occupation kills Palestinians not just through bombs and bullets, but it also destroys life by destroying homes, by destroying water infrastructure, power infrastructure, road networks, schools and universities, as well, of course, as health facilities. And so here we understand the destruction of the health sector as that broad definition of health, not just healthcare. It's not just about doctors and healthcare facilities, but also all of those things that sustain and reproduce life. And it's because of the rupture that the occupation and the colonial occupation has imposed in this war that this project then becomes important, because of the rupture, as Ghassan said, not just in Palestine, but on a global level, where every single hospital has been at a certain point damaged, destroyed, bombed, besieged, cut off, or been out of service, where we see over 500 health professionals having been martyred, and many of whom were targeted through assassinations in their homes, sometimes minutes or hours after they've just arrived home from long hospital shifts, and over 300 health professionals who've been abducted, at least two of whom, Dr. Adnan al-Bursh and Dr. Iyad Rantisi, who were tortured to death during their incarceration. And unfortunately, those are likely not the only examples. And so, so when it comes to thinking about this, this specific targeting of hospitals and of health facilities, it's because these targetings, the killing of the health sector, the killing of healthcare professionals, is an extension of Zionist colonial aims to exercise sovereignty over Palestinian bodies. So it's not just the killing of Palestinians, but deciding when a Palestinian is allowed to live and when a Palestinian is allowed to die. And so when we think of health, the health system, the place that is the ultimate space that affirms life, where we are born and where we are healed, targeting it is an extension of the colonizer's need to assert sovereignty over the lives of colonized subjects. And so when these health structures affirm life, they represent a resistance to the death world. And that's why it becomes then essential for Israel to target hospitals and do away with what is internationally known as that prohibition on targeting hospitals, because it's so important for Israel to assert its sovereignty over Palestinian lives, over the Palestinians' right to live. And so in this way, then, as Ghassan alluded to, Israel then starts to exert sovereignty, not just over the Palestinian body, but then over international law in general. And so that's where we see the importance, the global importance of documenting what has happened to the health system. And so the purpose of what we've been doing over the past several months is to, as you know, as we've mentioned, to document and publish details of attacks on the health sector, and then to also document the pre-existing emergency response structures that the Gazan people and the Gazan health system had created before the genocidal war had started, because of this, but also because of the long-standing history of understanding the role of medical resistance and resistance through health in the Palestinian struggle. And so we see that, from the resilience of doctors and nurses in Tal al-Za'atar, to other Palestinian refugee camps in Lebanon, to the formation of the health work committees and Palestinian Medical Relief Society within the borders of Palestine, George Habash and Wadi' Haddad's clinics in Jordan, and even as early as the 1930s, Palestinian doctors affirming the importance of health within the national struggle. And so all of that history is also important to bear in mind, and all of that Palestinian history is then important to bear in mind. So we aim here to highlight locally produced knowledge from the health workforce in Gaza, as well as the solidarity networks. And there are, I saw a few remarkable names in the attendees list of people who've been practicing that solidarity since the 70s with the Palestinian people, healthcare professionals who've practiced that solidarity. So that's the kind of knowledge that we want to foreground within this project, to emphasize the importance of that narrative. Now, onto the kind of more technical side of what we've been doing. As Jihad mentioned in the introduction, we mainly have so far used secondary data, in that we haven't actually gone into Gaza and conducted research ourselves, but have relied on sources that collect data from Gaza. So that's primarily, of course, the Ministry of Health and the ongoing efforts by various official and non-official initiatives within Gaza to document attacks on healthcare facilities, as well as obviously media sources and on the ground, field journalists, as well as doctors and everyday people. What we've also done is archived the response of various organizations that have worked within Gaza. So whether they're international or local organizations, we have archived public statements and reports and documents of organizations that are active in Gaza. And then we plan in the future, when we're able to then obviously collect first-hand accounts through primary interviews with witnesses and survivors to the genocide, and have started doing some of that work, but it will really start in earnest in the future. And it's important to highlight here that we've done this research not just on the events of the past 11 months, but also to try to understand the history of healthcare facilities. So we've looked at the history of every single one of the hospitals. When was it established, and how did it develop, and how was it affected during the siege, and how did people then respond to the challenges of the siege? And when it comes to, for example, healthcare personnel who were killed or incarcerated during the genocide, we've, in addition to documenting that they've been martyred or incarcerated, then also talked about their experiences. So, where did they train? How did they train? What was their expertise? What have we lost in losing those health professionals? Both as kind of a duty to them, but also to understand the expertise that Israel has deliberately destroyed during the genocide. And what we've produced is primarily a public database of each healthcare facility, and I'll go through that just through a little presentation, as well as analysis. So in addition to the events that we document, essentially a chronology that I will present to you shortly, we've also commissioned policy papers and blogs, and also conducted events and hosted short videos of people who present analysis of the health and the material and legal and political implications of the destruction of the health sector. And this is hopefully the first of many future events. And we will also aim in the future to have workshops and culminate in a conference to discuss these implications, and so to really try to bring things together. So I will just actually start to show you this database in case you haven't yet seen it, and go through some of the features that you see. And I'm just going to highlight 3 of these features. First of all, just I'll draw your attention to the top right corner when you click on the link. in that you can switch between Arabic and English, and if there is ever a delay in something being available between Arabic and English, it's only going to be by a couple of days. And so it's an entirely bilingual site. If we go through, for example, the health facilities, and so what you can see when you click on this is two sections. There's the hospitals section, where we detail each of the hospitals that were built before the genocide, and then the field hospitals. So 36 hospitals from before the war. And then we also have the health centers. So they're the primary healthcare clinics that are owned by the government. And then we're also adding the ones that are run by the UN Relief and Works Agency. So they're the kind of, that's the bulk of the healthcare facilities. So you can scroll through and look through the basic details of the hospitals, including their founding date and bed capacity and where they are. And then you can click on any of these hospitals to see more detail. And when you click on that, you'll see an introduction for each hospital, which shows you where it is, when it was founded, and these kind of basic facts, such as where it is and the people who worked in it. And then we highlight right at the top the main assaults that were conducted against it during the genocide. So starting with the earliest significant event, and we'll go through a more detailed chronology later on, right down to going through the months from October onwards, right to the reopening of the emergency department at Al-Shifa Hospital just 11 days ago, in a remarkable feat for the health system and for the resistance of the healthcare professionals there. We then detail the specialties and the equipment that were available at the hospital prior to the genocide, a description of its history from its foundation through the siege, starting in 2006, 2007. And then after that, we go through a chronology of the war. So almost where it's necessary, a day-by-day chronology of the attacks on this hospital. So, and you'll see sometimes that there are sporadic events. So in the first few days, there weren't kind of that many targeted attacks against Al-Shifa Hospital. There were a few. And then, as you know, in November was when there was the propaganda that was propagated against Al-Shifa Hospital, and then the siege, and then the invasion of the hospital. And so here you see a day-by-day chronology of what happened every single day in the hospital. And so starting from November 10th onwards. And then we go through all the way to the modern, until today, essentially. So that's the healthcare facilities section. We then talk about healthcare workers. So when you click on that, you will see a database of the healthcare workers who've been targeted by occupation forces. So there are over 500 health workers who have been martyred, and over 300 who've been abducted, some of whom have been released, but as I mentioned, some of whom we already know have been martyred, and others who we have no information about. And for these health workers who have been killed or abducted or disappeared, we just outline very briefly some of their achievements, what they worked as, what they specialized as, where they worked, and what we know about the circumstances in which they were targeted. So if we were to take the example of Dr. Adnan al-Bursh, we talk about his long, very rich history to really explain what we lost when Dr. Adnan al-Bursh was killed, and going through the day he was injured while working in the Indonesian hospital on the 20th of November, and then when he was arrested, and then when it was announced that he was killed under torture in Al-Fayh prison. And the last section, I'll just draw your attention to. You can, obviously go through the pages, in your own time. But the last one, I'm just going to briefly show you is the analysis section. And here is the section in which we we demonstrate the policy papers that we have commissioned for this project. And this is just some of them, and they highlight a wide range of things, such as the implications of the destruction of the health sector in general, and then more specific papers about, for example, health facilities in particular, about public health, how to think about rebuilding public health, infectious diseases, the implications of mass graves, and then medicide, or the kind of the targeting of hospitals and what that means. Blogs that describe people's individual experiences, whether through lectures or interviews or blogs that they have written kind of in free form. And so and that will continue to build on that. And this is one of the things that I really kind of want to emphasize, is something that we want as broad participation and as possible, in that we need to collaborate on these things. We need to think about these things as an effort that we think about together, all people who are interested in analyzing this, in understanding its implications through different angles. And so this is an invitation at the same time to approach us, and people have already, and I'm very grateful for the work that others have been doing and sharing with us. And so I want to extend this invitation, and you can kind of visit the website and email me as well, so that we can kind of engage in longer conversations and deep conversations about how we can push this work forward and uplift each other together. Thank you.
Thank you so much, Dr. Layth, for this detailed walkthrough and for this great presentation. And thank you and Dr. Ghassan and the entire team for working on this and producing this very important database that will be instrumental in understanding the scale of Israel's assault on the healthcare sector in Gaza, but also hopefully will be key in helping us imagine rebuilding it very soon, hopefully. Before I move to address questions by our audience, I have one question for you, Dr. Layth, and for Dr. Ghassan, about what is left of Gaza's healthcare sector now. We all know that Gaza's population has been concentrated in the Deir al-Balah area. There are still hundreds of thousands of people in the north of the so-called evacuation line, north of Wadi Gaza in Gaza City, and in other parts of northern Gaza. And there are people, of course, in whatever parts that survived from Khan Yunis. Rafah is still enduring a heavy assault. What is left of the healthcare sector, and how are people now able to access healthcare services? And are there any initiatives beyond documentation, initiatives that are short-term to address the massive gaps, assuming there will be a ceasefire soon, and we hope there will be a ceasefire soon? What would rebuilding this healthcare sector on the short term look like, and how are people accessing necessary life-saving treatment and care now?
So first of all, the health system, even those parts of it that were destroyed, remain the site of both the genocide and the resistance to genocide. So the Indonesian hospital has been refurbished and destroyed by the Israelis 3 times. Every time the Palestinians come back and refurbish it. As my colleagues at Al-Auda Hospital in Jabalia say, the functioning operating room at Al-Auda Hospital is turned on when there's enough fuel to put the generator on, and then so that they can operate, and then they run out of electricity because of the lack of fuel. And then the same in Al-Ahli Baptist Hospital. But to give you an example of the effectiveness of that, because of this destruction, continuous destruction, those wounded in the massacre of the Tabi'een school, the last school that was a center for the internally displaced that was bombed by the Israelis, the overwhelming majority of those wounded died of their wounds in the days that followed the massacre, because Al-Ahli Baptist didn't even have sterile gauze, that there were just not enough medical teams. There was no burns unit to look after the burns patients. And a similar process is happening in the south, where Nasser opens and then stays open as much as it can, and then the Israeli tanks advance again on Khan Yunis, and then it shuts down. And so effectively in the south, there are 2 Ministry of Health hospitals, and then there are 2 small hospitals. But at the same time, we know that the Palestinian health system is also the site at the moment for the struggle for Palestinian sovereignty. And the way the West and Western powers envisage Gaza in the post-war as a place with no sovereignty, and therefore a health system that is denied any national sovereignty and is run like Kosovo by international NGOs and UN agencies with no sovereignty to the people living there. And so we see there international NGOs who have set up separate health field clinics and field hospitals outside the health system, because they receive Western government funding from the British government and the US aid and the German government, not to have any cooperation with the Ministry of Health. And so we see that the Palestinian health system, whatever shape it's in at the moment, will remain a site for the struggle for Palestinian sovereignty and colonial demands, whether it's settler colonial demands by the Israelis or international colonial demands by Western powers, to usurp that sovereignty from the Palestinian health system.
Thank you, Dr. Ghassan.
I think the thing that will just add as well is you can see the struggle for control in also who's allowed access and then who's uplifted and then who's not given the same kind of spotlight. And so one of the things, for example, is banning now that it's the Israeli intelligence, not just the army, which are involved in vetting who goes into Gaza. And so, for example, there's now this kind of blanket rule on anyone who's even third-generation Palestinian entering Gaza, any kind of even from including kind of medical personnel, who's allowed to bring in equipment or not by Israel is also titrated according to exactly how, the dynamic that Ghassan was just describing. And so here lies that really, really important spirit of solidarity in practicing medicine and in delivering healthcare, where it's as Ghassan exactly. I just want to kind of really kind of zoom in on that point that Ghassan made, that it's not always. I think a lot of people kind of and humanitarian organizations sometimes will make us fall into the trap of thinking about, well, let's get in anyone that can, let's get in anything that can, no matter who we have to deal with, even if we have to sit down with Israeli intelligence, even if we have to sit down with CIA, whatever. But that's part of the trap that is laid in order to then remove that sovereignty from Palestinians. And so just always emphasizing on working with Palestinians on reaffirming our right to continue to control our health and our health sector then becomes actually foundational to the support and the solidarity that you want to exercise with Palestinians, because there's no way around it. A lot of things are going to have to come in, and a lot of people are going to have to come in from the outside because of the amount of destruction that's been inflicted on the health system in Gaza. There's too little left just to be left alone. There needs to be resources that are brought in from the outside, and so that question becomes really fundamental.
Thank you so much, Dr. Layth. I just want to highlight that we have more than 2,200 viewers on Twitter alone, in addition, of course, to those who are tuning on via Zoom and other social media channels. So I wanted to recognize everybody who's participating and joining this conversation. And we've received a lot of questions. And Dr. Layth, I don't know if this will be good or bad news for you, but there are plenty of offers and requests by many of those attending to join and support this project and provide translations, volunteer in various shapes and forms. So I think I commend and I'm really grateful for everyone who's joined and who's committing to supporting this project by translation or volunteering or taking any part in this project in the future. So Dr. Layth, expect plenty of emails reaching you in the next few days. And I can see many questions here, and I would like to basically capture the main points that these questions are trying to address. One of them about a question that has been asked by many about the utility and role of this database in future and ongoing legal efforts to hold Israel accountable, including the genocide case and other efforts. So I guess the question here, how do you envision this database playing a role as such in these kinds of legal efforts moving forward?
I think what is critical is that this database will be an archive, not just of events, but of testimonies, of eyewitnesses, of those who worked in the system and those who were treated by the system and those who witnessed the atrocities committed on the Palestinian health system. They will eventually be a critical component of a multitude of legal endeavors. We all owe it to the victims that they have a chance that those who perpetrated these crimes against them are brought to justice. And therefore, there has to be a process in which this archive acts as a repository of testimonies, so that because of the nature of war crimes and the fact that there's no statutes of limitation on the time that people can be taken to court for their crimes, it acts as a repository for all witness statements.
Thank you, Dr. Ghassan. Dr. Layth, would you like to add anything?
No, I think that covers it. I think, yeah, just important to kind of also think about everyone else who's doing that kind of work as well. And I think it sometimes, then gives ideas to others about the way that in which we can kind of use data, publicize data, because not everyone is going to be doing everything, right? And then that's part of why this is public as well, because then it might give also, it might generate ideas about what directions people can take with data that they might have, which we don't, for example, just to see how they can move forward with it.
Yeah, absolutely. And moving on to another set of questions here, and based on my understanding of this database in light and in the context of Israel's assault on the health sector in Gaza. We're not only witnessing just pure violent acts that are destructive. We are also witnessing new precedents that are being set in Gaza concerning the medical field, but also in other ways. We have a question from Bashir Ode who asks about whether these findings will find their way to international medical journals, and should this form the basis for more academic work. And I think this is important here. I think we lost Dr. Ghassan, but until he's back, I don't know if you'd like to comment on this, Dr. Layth. Dr. Ghassan started by framing this assault on Gaza's health sector in a way that I think is revolutionary and gives more meaning and analysis to the scale of this assault, but also its implications in the decades to come, not just in Gaza, not just in Palestine, but beyond that. I guess the question here is about the academic role of this database. Is this going to be to start as a virtual space to build connections with journals, with authors, with experts, to generate conversations around what has been happening in Gaza and its implications?
Yeah, I think it's exactly as you just said, right? It's a conversation, and it's not that this is an expressly academic work, although it draws on academic concepts. So, for example, the most recent piece that we've just published by Doctors Neve Gordon and Nicola Peragini talks about medicide, which is something that these two authors kind of conceptualized, relatively recently, and then they're kind of applying that concept to within kind of this within a policy paper for this database. And so that's kind of part of that conversation, right? So there is that, and actually one of the academic papers on this is in the Journal of Palestine Studies. So there's going to be this conversation that inevitably happens that we do want to encourage, but I think it's about multiple levels, right? So there is the use, the public use. There is this thing that we need to think about, the collective memory that we need to steer into anyone who wants to work within this space, whether they're health professionals or not, because of just how exceptional this situation is, that the rupture that everything that's been going on represents is really important, not just for academics. It's important for the public. It's important for absolutely everyone to see it into them and to understand. And so when we think, for example, of policy papers and blogs, they're meant to be things that are read by the general public, but then that obviously then becomes generative for how we discuss the targeting of health systems in Gaza, but then how that plays into other wars, other instances of colonial powers trying to exercise sovereignty over colonized bodies. That is obviously, because there is that basis of it, there is the exceptionalizing bit, talking about how this is exceptional, and then the de-exceptionalizing, and that requires an academic conversation in some sense. And it can be academic in the kind of traditional sense, and so both Ghassan and I do write in international medical journals, but then we also write in things that are more for public use, because it's about the whole of society. It's about communities having that conversation, not just an academic conversation. So we hope it's a bit of that it works on all levels, at least from my point of view. I don't know if Ghassan, you caught some of that and can speak to that, the potential kind of academic aims or developments that we might see.
So for me, the critical part of it is that kind of junction between what is information that is available for academics to draw on and conversations that are available for academics to draw on, but are still accessible to those who engage on an activist level in Palestine. It is critical, almost in a kind of translational research sort of way, that this archiving is available to be converted into material for political activism. It is critical that in a kind of transitional research way that all of the evidence that is there is available for legal activism, and also while still remains available for those within academia who want to push the boundaries of different disciplines and bring in Palestine into the conversations with regards to whether they want to use the lens of political geography or medical anthropology or straightforward political science or whatever lens they want to see Palestine through. It's critical that that archive is available for them to use, to build on, while not becoming so specialized that those who are engaged in political activism are unable to draw and benefit.
Thank you, Dr. Ghassan. And just to, when we missed you briefly, there was also a question about the academic role of this database. And I linked that question to how you started your presentation with framing what has been happening in Gaza, and not just as an event that is confined to Gaza itself, but also with universal implications. How do you see this database and the events in Gaza, which are unprecedented in certain ways in terms of the intensity and the scale of the assault on the healthcare sector? How do you see this framing going to be captured by scholars and academics moving forward? Do you encourage people to look into that and reflect on what has been happening beyond just capturing the events, but rather their implications?
The sheer magnitude of what is happening in terms of phenomena that we haven't seen before on this scale. You know, this war, to give you a very kind of brief example, this war has, we now expect, has led to around 11,000 Palestinian children losing limbs. This is the largest cohort of pediatric amputees in the history of warfare. Beyond Iraq in its longer war, beyond Afghanistan, it's longer. And so on a clinical level, it's critical to try to understand the health implications of such a calamity on a public health level, on a sociological level, on an anthropological level, on a mental health level. All of these things, this magnitude of this crime, beggars for us to try each in our own academic fields, to look at it from our vantage point, to try to understand it in order to try to come up with modes of alleviating that pain and finding solutions for those who have been wounded by this process.
Thank you, Dr. Ghassan. We have a number of questions on those who have been abducted specifically. So healthcare workers who have been abducted, I believe this has been addressed. But if you would like to add anything else about how the database continues to document and follow the fate of those who are missing, abducted, and continue to be murdered in Israel's detention camps.
Well, I think here it's obviously what we try to do is we follow, as I said, kind of any secondary sources that have reported on all of the health professionals who've been abducted. And here I actually want to take a moment for a shout out to an incredible group of Gazan health worker volunteers who are based outside of Gaza, called Healthcare Workers Watch, who have compiled the most comprehensive lists of health workers who've been targeted, and particularly kind of documenting each name with with where they've been working and what they've been working as, and they've actually formed a foundational source, as we mentioned in the database. That they have actually kind of been doing actually some of the most remarkable work, because also they've already been doing primary data collection, and so they have kind of some of the most comprehensive sources of data on abducted health workers. So I would encourage you to also follow their primary data collection work that they've been doing. And then in addition to that, I think it's also just really important to point out that there are many people who are missing, people who've been disappeared. So people that we don't know for sure whether they've been killed or abducted, or whether they have actually disappeared in order to protect themselves from being targeted. And that's actually a remarkable figure. It's not small. I can't remember the number off the top of my head, but it's not a small number of people who fit that category. And so that is part of that violence, right? It's people who've been torn apart from their communities, from their families, from their networks, and from their workplaces, and we don't know anything about them. And so there are people who are being held in various detention camps and torture camps and torture chambers that we, for example, only hear about when someone from one of these camps has been released. And that's part of the machinery, the incarceration machine that Israel has created, that has put the abducted Palestinian body in the most extreme form of exception, where it lives, at the very edge of the margin, especially Gazans who Israelis actually amended several laws in order to be able to exercise even more control over their bodies without any accountability. So people who can be held essentially for months without the Israeli army even presenting information about their whereabouts by amending laws. It's a perfectly legal practice that they're now doing in order to do that. And so it's a really important issue that I know I'm offering more questions about than answers, but it's because it is essentially one of those black holes that Israel's created by making exceptions within the exceptions, margins within the margins. And it's important to continue to track that and to continue to advocate on, not to advocate, but kind of to push as much as possible that this is happening, and that this is one of the most extreme forms of violence that Israel is enacting on health.
Thank you, Layth. Dr. Ghassan, would you like to add to what Dr. Layth
No.
Okay, thank you. We have a couple of technical questions, Dr. Layth, about the safety and security of the information of the database. So if you'd like to just say something briefly about that, and then I'll move to the final question.
Of course. So there are several things that we do. So it's important to quickly point out something that may not be surprising. The Institute for Palestine Studies, as well as many other Palestinian organizations, have come under huge waves of cyber attacks that have really kind of increased and been exacerbated since the beginning of the genocide, particularly organizations that are essentially unwilling to bend when it comes to the discourse and the way in which they present things. So anyone who's kind of fearless tries to be silenced. As anyone who's tried to be vocal will know. And so that is something that we have already faced. And so that mitigating that involves taking out more space on the servers in order to have like a kind of bigger leeway. I'm explaining things as simply as I understand them, because I'm also kind of not a programmer. So there's the kind of trying to have backups on the servers, but then also more space on servers. And there's also taking offline copies on a regular basis. That's something that we do, taking offline copies of everything so that we make sure that even if we are unable to withstand an attack, that we still have that data and can just kind of go live again in case of anything. But it does require, quite a lot of work from our programmers who are doing absolutely incredible work to kind of keep everything ticking, let alone produce all of these new databases and new pages and maintain them on the website. So it's hard work for the programmers for sure, and yeah, they're definitely some invisible soldiers in this.
Thank you, Dr. Layth. And my final question for you both is basically a question that has been repeated by those who are tuning in about ways to support this initiative and this database. And I would like to, if I may, to encourage people to support the work of IPS. The database which is a big part of, and I will also talk a little bit more about how to support our work. But I know we have addressed specific requests and offers in the chat, but if there's anything else you would like to say in general in response to this question about supporting this initiative and joining this effort moving forward.
So I think it is critical that as everybody who's been listening in and watching us has dawned on, is that the magnitude of the work ahead is beyond the capabilities of a single institution. And therefore, it is critical to put a call out for people who want to assist in the collection of data, in the archiving, organizations that want to help in this process, that they come forward, so that the more viscous or intricate or pixelated this archive becomes, the more benefit that we will have for anyone who wants to use it for any purpose, whether it's legal, activism, future academic endeavors. And so this is just a call for collaboration and collaborators as individuals and as institutions.
Thank you, Dr. Ghassan.
I would completely echo that, Ghassan. I think that we know, us on this call, everyone who's been supporting this work, everyone who's been dedicating themselves to this kind of work since the genocide started, if they are outside of Gaza, but people who've also been going in and volunteering or working or supporting materially, that the systems that include, and that includes the knowledge systems that dominate, that are hegemonic, try to stand in the way, or are designed in order to support the genocide that has been going on and the ethnic cleansing that has been inflicted on Palestinians for decades. And so the response to that is to build systems, including systems of knowledge, including systems of medical practice, including systems of medical solidarity, that combat that, and to try to build the world that can materially try to move towards justice. And that's the kind of material fight that we are in. And that includes the academic fight and or the kind of the knowledge production fight. And so that's why it's that's where it becomes incredibly important to collaborate. That's where it becomes incredibly important to gather resources and to think together and to argue together and to pull our resources together. So yeah, my call would be similar to Ghassan's. Let's be in conversation. Let's try to build on each other's work and create those alternative systems in knowledge, but also in practice.
Thank you so much. And before I move to conclude this excellent event, I would like to ask if any of you has a final message or anything that you would like to say before we conclude.
I think we would be remiss if we don't end this with a salute to the Palestinian health workers who, almost 12 months on, continue to dig through the rubble, to save people's lives, to go back to hospitals that they know are being targeted, to work in conditions that they know are unacceptable, but they have no other option. And I think none of us would have been here talking about the Palestinian health system without the really historically astounding levels of bravery, dedication, devotion, humanity, civilization of Palestinian health workers, both those who made the ultimate sacrifice, like Dr. Adnan al-Bursh, like Dr. Ahmed Maqadme, or those who are still fighting the good fight, both in the north and the south. None of this work means anything without your bravery. And the whole idea of this work is to hold a very small candle for the world to learn from you, as humanity tries to learn from you what it means to be health workers.
Thank you so much for these powerful words, Dr. Ghassan. Dr. Layth.
Can't say it better. I think I can't say any better than that.
Thank you. Thank you both. And before we close, I would like to thank everyone who's attended and participated and submitted questions and comments, and especially those who committed to helping supporting this initiative moving forward. And special thanks again to you, Dr. Ghassan Abu-Sittah and Dr. Layth Hanbali, for your valuable insights today and for your incredible work on making this database possible. I would like to remind everyone that IPS and IPS USA is committed to continuing this crucial work of documenting Israel's assault on Palestinian life, existence, and dignity. So please consider supporting us and stay tuned for our future projects and events and publications, including our upcoming launch of our database on the destruction of the education sector in Gaza. You can find more details on all of our work at palestine-studies.org. Thank you all for joining us, and we look forward to seeing you at future IPS events. Dr. Layth and Dr. Ghassan, يعطيكم ألف عافية. Thank you so much.
جزيلك عافية. شكرا جهاد.